Typically when I do these presentations, I like to keep it really interactive. I want to speak about the things that you guys really want to learn about, the pressing issues, the things that maybe keep you up at night or things that keep getting brought up in different meetings. So at any time in this presentation, feel free to send a chat. And Amy can interrupt me at any time to ask any questions or maybe guide the direction that this presentation is going in a little bit. But obviously, because we're on Zoom, it's a little bit harder to be as interactive as we once were when we did these presentations live. Can you all see my PowerPoint okay?
Yes, perfect.
Perfect. And we can send these slides out as well as some different help sheets that we've put together. So obviously partnering with people in mental health, making sure people can access treatment and information as needed is really important, especially because mental health can kind of be like a great unknown for many people, and there's lots of myths and misunderstandings with it. So the objectives that I have, just increasing awareness in the workplace, especially with mental health concerns and substance use concerns. Thinking about the manufacturing industry, you could have heightened risks for both within employees who work in these various workplaces. And then overall, just improving the workplace. Obviously, with the pandemic going on, one of the earlier comments I was given is kind of the employees who may be disgruntled about having to work while other people, maybe the ones running the company, are sitting at home safely, kind of away from the pandemic. For the purpose of this presentation, obviously we can understand that many individuals are working in high-risk areas where they could be exposed to COVID. But it doesn't just mean that these people are in manufacturing facilities or in factories. These are doctors and nurses, very highly educated people, are still doing what they need to do every day. We also know many business owners, many CEOs, a lot of really important, highly educated people are not necessarily on the front lines, but still doing what they need to do every day. So with employees, kind of trying to change that conversation a little bit, the best thing you can do is offer somebody empathy. For whatever reason, they feel like it's unfair that they're in this situation and you're not. So trying to understand their fears and their anxieties and do your best to connect with them in a passionate way, understanding that you might not be in this situation, but you can imagine how it would feel, especially if they have someone at home that may be having health issues or their kids are doing Zoom from home. This time can be very stressful for leaders of different organizations, really just showing that you care, genuinely understanding that people do have very real concerns and they might not be as concerning to you, but acknowledging the importance to your employees is really important right now. And if you guys have more questions specifically on, the pandemic and work stress, definitely ask throughout the presentation. So just looking at the stigma, people with mental health issues do go to work every day. However, 8 in 10 of them won't seek treatment just because of the pure shame and fear. I know professionals, psychiatrists, therapists who would not go into therapy or seek treatment themselves. And these are the people who are right in it. So there's a lot of conversations that need to change, because even people who talk about suicide and mental health issues every single day would struggle to get access to treatment. 68% of employees would hide that from a coworker. A lot of you probably wouldn't discuss any sort of medical issue, let alone a mental health concern that you may be having with someone. And only 4.5% of employees are accessing EAPs. So even though a lot of people, pay a great deal of money to be able to offer these services, their employees really aren't accessing it. And a lot of that is just due to fear that it could get back to their employee. Obviously in mental health, and especially with substance use, we take privacy very seriously. Confidentiality is really important. So always encouraging your staff not only to share with you when they may be struggling, but letting them know, you don't have to tell me exactly what's wrong. All I need to know is that you need help and I'll be here for you. There is a huge financial impact with both substance use and mental health concerns. Really just missing work, not being as strong of as an employee as you could be. But understanding how this could impact different businesses, getting it on the front end, looking at how you could have a return on investment for investing in mental health, making it okay to talk about. As leaders, I wouldn't necessarily encourage you to talk about your own specific mental health issues, just because, as a therapist, I want my patients to view me as someone who is stable and able to help and able to lead. So if a person would ever ask me, well, have you struggled the way I've struggled? I would always answer, part of the human condition is that we struggle at various times through our lives. No one gets out of life unscathed. No one is immune to job loss, the death of a pet, family, friend. We all have times where we experience heightened anxiety or depression. So you can relate to them in the sense that you too are human. You too have different stressors. And another thing, I would never encourage you to complain to employees just because for whatever reason they almost feel like you should be immune to that. They can send their concerns upwards, but they don't really want to hear about your concerns coming down. So a lot of Americans do experience mental health and substance use issues. At Prairie St. John's in Fargo, if you aren't familiar with us, we treat very normal people every single day. It's not that textbook one flew over the cuckoo's nest. It's a very controlled environment where people who have jobs, families, and responsibilities come in because it got to the point where they couldn't manage, outside on their own. So being able to get people connected to help as early as possible is really important to us. So 1 in 5 Americans will have a mental health diagnosis each year. Different industries may have higher rates of mental health or substance use concerns, but always think of yourself or any of your employees, family, friends. Mental health is on a spectrum. So hopefully we're functioning well, we're able to wake up, take care of our things, we're feeling healthy, we're feeling good about ourselves. We have a good outlook on the future. Then maybe an unfortunate incident happens, you start coping. You're not doing the best you could be, but you're able to manage to an extent. As you move down the spectrum, you might get to the point where you're struggling or just flat out doing unwell. And this is the point where you need to get help. You need to have somebody kind of step in. And for our patients, about 50% of them come to us voluntarily. The other 50% would come either on a Minnesota hold or a North Dakota hold. That's where a doctor or law enforcement in the community felt, you really need help. You're not seeing this yourself, but we're going to do this for you. So for the people, however they get to the hospital, sometimes it's family encouraging them or friends, these people may be reluctant to get treatment at the beginning, or they say, I don't need to be here, I can handle this. The majority of patients that I talk to when they discharge say, I'm so glad I was able to go there. I was finally able to just get this stuff out, learn how to cope, get some medication that's going to help me manage these symptoms, and I truly feel a lot better. 94% of patients who leave our facility report feeling better when they first got in. So just knowing treatment is available, and we're always happy to help. All of your employees have their baseline functioning. Full assistance is required for younger children, older adults, people with disabilities, but the majority of the people you're working with are probably in full independence in adulthood. You may notice changes in your employees' functioning or your family, your friends, yourself before they recognize it themselves. There are a lot of hallmarks of mental health issues. A big one is irritability, just not being able to handle those little things that we used to just kind of blow off. So understanding how we can kind of recognize those things and help point it out in others if we notice they're struggling. And of course, doing that in a very thoughtful, compassionate way, never being accusatory. So basically just mental health 101, it's anything that's affecting your thinking, feelings, or mood. The diagnoses that we would offer would fall into different categories. Sometimes it impacts how you can relate to others or how you can function. And there's no single indicator, but it's always a combination of factors that would make up a diagnosis. People do really well when they have meaningful roles, such as a job that they go to that keeps them accountable. They have support and they're able to access treatment and care. When we send these slides out, you can always go into these a little bit more in depth. I won't get too detailed on some of these just because in the best interest of time. But the easiest one to spot is just a change in appearance, personal hygiene, complaining of pain or fatigue, just not feeling well, not being able to kind of pay attention in a conversation, getting confused easily. And always I caution you against trying to diagnose someone yourself with a mental health issue, but regular people can identify when somebody may be struggling and try to reach out for help. Basic changes in performance. This is really good for HR to always recognize. When somebody constantly calls in after football Sunday or on a Monday after a holiday, they may have an issue with substance use. They may be engaging in excessive drinking the night before, and you'll start to see these patterns show up when you track it. Obviously, in certain industries, sobriety and having a very sharp mind is really important. So talking to your employees about when you notice these changes in performance happening. Know that all of your employees have risk factors and protective factors. The risk factors are what makes them more vulnerable to different stressors that may be occurring in their lives. They might not have stable housing. They might not have enough income to pay for child support or different food that they need. But at the same time, all of your employees have protective factors. They may have a mom who's always been really supportive and can help them out when they need it. They may have health insurance that can pay for services. So knowing that even though some of our people we work with have a lot against them, every single adult has protective factors. Even, you know, a homeless adult with schizophrenia out on the streets, they still have their own personal experiences and memories. Those are things that you can't take away from someone. These are just some different disorders that adults you work with may be impacted by. Anxiety and burnout are huge. Depression and stress. So we'll just kind of cover those a little bit. When anybody is struggling with mental health, the best place to start is a medical checkup. If you go to the doctor, do a lab draw, you know, urine analysis, a blood analysis, a lot of times they can find things that may mimic a mental health issue, but it's really just a medical issue. A lot of adults are vitamin deficient. They may be struggling with dehydration. So understanding that when somebody's struggling, just refer them to their primary care. Say, have you been to the doctor in a while? I wonder if you explain what you're feeling to them, if they would be able to do something to help you out right now. Therapy and medication are always options. They always work best together, but some people are against taking medications for mental health issues and would choose just to do therapy on its own. There's also day treatment. So a program we offer at Prairie St. John's, it's called partial hospitalization programming. And these are the adults that have jobs, they function really well, they have a lifestyle. They'll come here for treatment during the day, sometimes for 2 or 4 weeks. They meet with a psychiatrist, therapist, social worker, and within the groups, they can process through a lot of what they're experiencing, find better ways to cope and kind of manage their life better. So this is always a really good option for employees who are able to get time off from work, or if it's getting to the point where they, you know, they're asked to be off from work for a little bit. You know, if you encourage someone to go get help, this is a program that I would highly recommend. Obviously, a person would have to be referred into it by a doctor, but knowing what the resources are and letting people know that there are definitely options out there. The highest level of care is hospitalization. It's always avoided. But if a person is experiencing suicidal ideation with a plan and intent to carry out that plan, they do need to be hospitalized under the law in Minnesota and North Dakota. If you can't ensure safety, extra steps do have to be taken. Understanding suicide is really high, and obviously with the pandemic, job instability, very poor outlook. Nobody really knows how many more months or even years this is going to go on. So these statistics are just from a couple years ago, but I do want to point out every year about 45,000 people in the U.S. Die by suicide. The important thing to remember is that males who work, who have jobs, and have access to lethal means are the highest group to die by suicide. Women will attempt suicide about twice as often, but men tend to use more lethal means when they attempt suicide, which is generally a firearm. So if 45,000 people died last year, about 22,000 of them would still be with us if they didn't have access to a firearm on that stressful day they were experiencing. The important thing to remember with suicidality is that it's very ambivalent. People don't ever commit to wanting to end their lives. It's really more about ending the pain that they're experiencing. If you're having a really hard time, you don't see a way out, your brain can kind of convince you that it will never get better. This is the solution. So as much as a person doesn't want to take that road, sometimes they feel like it's the only choice. If no one intervenes and offers them a hand up, they may die by suicide. So if you know somebody who has access to firearms in their home, you are concerned about them, maybe they're just unpredictable or erratic, always say, I'm really concerned about you. I know what the statistics say. If we remove these firearms, it can help you be a lot safer right now. I've had this conversation with people before. It can be difficult, especially given people's different beliefs on having firearms. But truthfully, that is the number one thing for white males who are employed, is just removing the firearms from the home. These sites have a lot of contributing factors. There's no one thing that leads somebody to suicidal ideation, but it is important to understand the best thing that we can do as humans is offer support to one another. Even if you've never had a suicidal thought in your life, you could never understand why someone would do that. Just imagine how hard it would be if you really felt that was your only option. There's always suicide resources. I would keep these posted in your workplace. Crisis lines, 911, or going to an emergency room or a psychiatric hospital like Prairie St. John's. Being really empathetic, offering as much support as you can, and don't ever hesitate to say, I'm really not a professional, but I want to make sure you're okay right now. What can I do to help you? People experiencing depression may be very hesitant to reach out. So as an employer, being able to take that first step, even if it feels scary and you're not sure what to do, and acknowledging that really. I'm just going to go through a little bit to substance use. Substance use is very commonly occurring with mental health concerns. It is a very strong belief that that in the manufacturing industry, people may use substances more because of the camaraderie that they build with people. So it's just kind of an acceptance, a culturally accepted thing. The workplaces my parents worked at growing up, I remember every Friday they would bring in a case of beer and everyone would go into the same area and have alcohol before driving home. So think about somebody in recovery or struggling with alcohol. Normal people can drink 1 or 2 drinks and they know when to stop. People with substance use disorder, if 2 is good, 4 is better. If 4 is good, 8 is better. They really don't have a stopping point. So sometimes that one drink offering can kind of trigger them more into a binge drinking episode. But understanding that there are a lot of people who live very healthy lives and don't drink alcohol. Sometimes people think of them as like, it's an endless church picnic. Where's the fun in that? But I do think the culture is shifting a little bit so that people do feel safe and healthy not engaging in substance use. And of course, there's economic impact in that as well. There's a lot of contributing factors to different substance use, but really making it a zero tolerance policy, at your workplace, and not letting people engage in substance use or not normalizing it or glorifying it, if you will. So always encourage your employees in the decision-making process, promote work-life balance as much as you can. Generationally, some people view those who work 60 hours a week as the hardest workers. Where really somebody who works 40 hours a week but does so really well could actually be more successful in their job because they're able to balance their work and their life. So when workplace laws first came into effect, which I'm sure many of you are familiar with, they felt that it was most appropriate to have 8 hours of work, 8 hours of free time, and then 8 hours of sleep. It's kind of a good way to divide your day and encouraging your employees to do that. Kind of getting rid of that culture of whoever works the most overtime is our most valuable employee. All of this matters because we really want to increase engagement and morale as much as we can. We don't want people to be at the workplace feeling incredibly defeated or that people aren't listening to us. We want to have employees that we can retain. We want to increase their productivity. You guys have all heard of organizations that do a really good job of keeping their employees happy. That's excellent PR for any organization, knowing that people like working there and they're proud to say that this is their place of employment. And of course, we want to reduce any type of absenteeism, conflicts, grievances, or injuries. If you have someone at your workplace who's struggling with mental health or substance use, the best thing they can do is be on a schedule, have something that's accountable to them, and something that they can look forward to every day. So as we kind of wrap down the end of this section of the presentation, I'll leave all of our contact information up here, but I'm just wondering if anybody has any questions or if you have more of a direction that you'd like me to go in.